Support for Conversations Live comes from the Gertrude J. Sant Endowment, the James H. Olave Family Endowment, and from viewers like you. Thank you.
Good evening, and welcome to Conversations Live. I'm Carolyn Donaldson. As COVID-19 vaccines are now being distributed in Pennsylvania and across our country, there are many questions and concerns. How effective are the vaccines? Can someone transmit the virus even after getting vaccinated? When will things return to, quote, normal? Here to answer these and other questions are our guest experts, brought to you safely in over Zoom. Dr. David Burwell is Chief Quality Officer for UPMC Altoona, Bedford, Somerset, and Western Maryland. His expertise includes health informatics, family medicine, and patient safety. And Professor Beth McGraw is the director of the Center for Infectious Disease Dynamics at Penn State and a professor and Huck Scholar in entomology. Her research includes work on the biology and evolution of viruses. You too can join tonight's conversation, whether you are watching us on air, online, or through our live stream, or on our Facebook Live, or on the radio listening to us right now. In all cases, our toll-free number is 1-800-543-8242. We'll have that number up at the bottom of your screen, and you can email us with your question if you prefer to connect at wpsu.org. David, Beth, thank you very much for taking very valuable time in your specialties to join us remotely and safely tonight. We have so much to get to, and we are most importantly going to try to get to as many questions as possible. We ask for you to be succinct when you are on, or in framing your question if you email us in. But we'd like to begin, if we can, with the look at the science. Let's go with the science, as we've heard over and over, and we're going to ask Dr. Burwell to start out the discussion quickly with a look at exactly what this COVID-19 vaccine is, in layman's terms, please, and also how it varies or differs from the other vaccines that maybe we were used to getting over the years. So, Dr. Burwell, we ask for you to join us first with a look and a little description about what we're looking at with COVID-19 vaccines.
Yes, Carolyn, thank you. I just want to spend a little time here so we can discuss the vaccine. As a family physician, I find that it really works best if we kind of go over what the vaccine is, what it looks like, and how it works, in order to make sure that folks are informed whenever it is their turn, that they can make a good decision that is right for them on whether or not they can be vaccinated. So if we can go through that tonight, I'd be happy to do that. But I think it's really key because there's different information out there. And I want to make sure that the listeners of this program and the viewers have a chance to really make their own decisions.
Great. So let's take a look at that first graphic that kind of walks us through a little bit about how this vaccine is different. We've heard different definitions in different terms. Does it have a live virus in it, or what does mRNA really stand for, Dr. Burwell?
Yeah, so thank you. I think that's a good segue. So right now we have two vaccines that have an emergency use authorization. One from Pfizer and one from Moderna, and they are this type that's an mRNA vaccine. The mRNA science has been known for quite a while. We have made some vaccines from it in the past, but we have not utilized them to this extent. So I think that's why some people believe this may be a newer model. But let's go ahead and let's talk about what this mRNA is. mRNA, messenger RNA, is a type of, let's say it's a recipe. And this is the recipe mix for how a part of the coronavirus is actually developed. So you can see that the mRNA vaccine in and of itself is part of the mRNA is wrapped in a fat molecule, and that molecule is then injected under the skin. The mRNA then goes into the cells. It does not go into the nucleus of the cell. It does not mix with DNA, but what it does in the portion of the cell that's kind of the middle of the cell is it's red, and the cell itself creates these spike proteins. The spike protein goes to the outer portion of the cell, and it simulates like the coronavirus on the outside of this portion of the coronavirus, the spike protein, and the body develops antibodies to that protein. Then those antibodies remain in our system. And what happens is when we do get exposed or we do come in contact with the coronavirus, those antibodies are able to attach to the spike proteins and thus reduce the likelihood of getting serious infections. And those are the efficacy numbers that we look at for these different types of vaccines that I'm sure we'll get into. But what you can see from this graphic is a couple things. So if the mRNA only codes for a portion called the spike protein, then you can see right there that you cannot develop the coronavirus or get the coronavirus from the vaccine itself. Also, other things that you can see is that it doesn't mix with portions of your DNA. So it does not involve that section, so you wouldn't think that it would alter your DNA or these other types of misinformation out there.
All right, we're gonna take a little brief respite from looking at all that and comparing it now with the Johnson & Johnson vaccine that is just now, we understand, perhaps getting even FDA approval as early as tomorrow. And I want to ask Beth at this point to take a look at how we talk about, the phases that this went through for the approval and the FDA's approval and the fact that some say this was sped through the process. But Beth, can you walk us through a little bit about the process for the approval of these vaccines that we're now seeing out, getting folks vaccinated?
Yeah, I think it's really important to reassure people that these vaccines have gone through all the traditional safety testing. So that really involves what we call phase 1, 2, and 3 trials. And those are ever-growing large groups of people who are being tested, first to make sure the vaccine is safe, it's not causing side effects, and second, that vaccine is efficacious. So is it really working to prevent infection? And we do this in large groups of individuals. We try to capture all different age classes, so that we really understand if the vaccine is going to work in a broad cross-section of the population. Now, the reason we were able to go so quickly this time and come about with vaccine approval within a year rather than maybe around 4 years, which is an example of some of our faster vaccines, is that instead of doing a lot of these studies sequentially, so one after the other, we ran a number of them in parallel. And that also applies to production. So normally we would run all the phase 1, 2, 3 and 1, 2, and 3 trials back to back, and then we would wait to see the progressive results from each one before going to the next stage and before beginning production of the vaccine. What we've done this time is just stack all of those things and run them in parallel so we could get through all of that safety testing much faster, but still have all of the safety testing there that we need and that the FDA is looking for to make sure it's safe before it's approved. So no one should be concerned that we didn't go through the traditional safety testing.
All right. Thank you, Beth. We do have our first caller. We want to get to that. And again, that number is open, 1-800-543-8242. If you're just joining us, we'd like to have your question posed to our panel of experts. Dick from Johnstown, you're on the air. What is your question tonight, sir?
Yeah, good evening. A family member received the first dose and was scheduled to receive the second dose within 30 days. Just a few days ago, he got an email stating that the second dose has been pushed back 10 days or 2 weeks, whatever. But it was said that it's still within CDC guidelines. What is the outer limit between the first injection and the second that will still maintain its efficacy? The email did not say that. Thank you.
All right. Thank you, Dick. Who would like to address that?
I'd be happy to talk to that. So yes, thank you for the call. So a couple of the questions have been the timing. So the Pfizer vaccine optimal time is 21 days after the initial injection, and then the Moderna is 28 days. So what Moderna has also shown, and I think this is what you're talking about, Dick, is because you referenced 30 days. They've updated their guidelines to have a 14-day trial period, or actually grace period in between there. But what we are seeing, especially out of the UK, they have noticed that there's been efficacy with even further gaps in receiving that second dose. So I just gave you what they came from the manufacturers, but also we have seen that it still remains efficacious if there's even a larger period of time in between the first and second doses.
All right. Thank you for that explanation. Now, Dr. Burwell, going off of that, with this third vaccine that could soon be available in the United States and perhaps as quickly coming out here, is the Johnson & Johnson vaccine, which has a different makeup a little bit and actually has a little different dosage. It's a one dose, I understand, and its storage is quite different. So I'll go back to you, Dr. Burwell, and I know you have another graphic to kind of explain the difference within the COVID vaccines and how they're made up.
Right. So the J&J vaccine that is, I believe, going for their emergency use authorization even as early as tomorrow, depending, is a little bit different. It has a virus as its type of vector as far as going into the cell. It's a type of adenovirus that does not reproduce in the cell, so you do not get sick from that type of virus vector. As you can see in the graphic, is that it has a DNA for a portion of the spike protein again, of the coronavirus. It becomes, it's injected under the skin, it gets engulfed into the cell, and then that DNA is then inserted into the nucleus area of the cell. The DNA for that that's encapsulated and encoded for the protein, the spike protein, then is translated into mRNA, similar to the other vaccine, and then this mRNA then develops is read like a recipe, and the cell creates these spike proteins that go onto the outside that our bodies will then create an immune response against. So this is pretty exciting. It's a one-shot vaccine. There's some other positives that they note within it, because it actually creates spike proteins that also remains in the cell. So when the cell goes through its life cycle, that actually does release into the body as well, and you can develop additional immune response from that. So this is pretty exciting. It is a one-shot vaccine, and there are some differences because that virus, the adenovirus, is let's say more stable. It's easy to store it, so it does not have to be frozen per se for transit and things such as this. So that means that we can distribute it even easier to remote places and keep it in refrigerators for periods of time. So it's pretty exciting, and I think it is a vaccine that will be helpful as part of our options.
Great. We'll get to accessibility here and how the distribution methods and what type of vaccines may be coming down the pike and what are here, especially at Dr. Burwell's place. But we do want to get to our next caller, Barbara from State College. Barbara, good evening. Thanks for joining us. Your question, please.
Oh, good evening, Carolyn. Thank you. You know, I have friends, and it's surprising me how many people are not getting the virus. Some of it's fear-based, and the thing I heard this week was, well, you know, when I get the first vaccine, I'll probably be okay, but it's the second one that's going to make me terribly ill. So some people are saying, well, I'll take my vacation around that second dose. And, you know, the only way I can really explain it is, well, the first vaccine is priming your body, so you're ready to fight it. And then you won't react and probably get sick. But the second dose, yes, because it's the... Can you explain that better than I could?
Yes, give us some talking points, Dr. Burwell or Beth, or both of you, as to how to combat perhaps some of this misinformation that's out there.
I think I would say to remember that when your body is having those reactions, that's a good sign. means your immune system is noticing that it's got this spike protein inside the body and it's doing its job. So while some of those symptoms are uncomfortable, you might have a sore arm, some people are having fever, feeling a bit fuzzy for a few days. Just realizing that that's really a sign that your body's doing its job and it's going to end up leaving you protected after you've had your vaccines. And I'd also encourage people who are nervous to really talk to friends and family who have also gotten the vaccine to provide some reassurance for themselves.
Dr. Burwell, are you finding boots on the ground in the places where you are quality control manager over, what has been the response for those who have been getting vaccinated with their side effects?
Yeah, we're seeing exactly what was seen in these studies. We're seeing that people are experiencing at a percent arm pain, maybe low-grade fever, fatigue. The majority of symptoms last 1 to 3 days after the first shot. They can be noticing even a more of a robust immune response with the second vaccine. It depends. We've had that multiple. I've had the vaccine. I can tell you that I had a sore arm, but it was less than my tetanus shot. So, it went away. It's nothing to even write home about. But I think there are some individuals that do have a little bit of fatigue and headache and dizziness afterwards for a few days. But we're not seeing substantial side effects that are or allergic reactions or other types of things associated that are outside of the study. We're seeing a pretty safe and like Dr. McGraw mentioned, I mean, the immune response is what we're noticing.
All right. We have an email question that came in, but first, before we get to that, can I ask both or one of you about the variants? There are some concerns now that will any of the three that you just described, Dr. Burwell or Beth, weigh in on this, the UK variant, the British variant, this African variant, will these vaccines still work? What are we finding science telling us at this point?
I don't think we have all the answers on all of that yet. So I know there's been some evidence that the Johnson & Johnson vaccine works quite well against some of these variants. We know that AstraZeneca vaccine, which hasn't been approved for use in the US yet, is struggling with the South African variant. So there's going to be strong efficacy, but potentially some reduction in that in response to some of these variants. That's why it's really important for us to vaccinate as many people as possible, as quickly as possible, because the more people we have transmitting this virus, the more opportunity we have for new variants to arise. So it's a little bit of a race to get out front of the emergence of additional variants and then trying to make sure that our current vaccines are effective. I know that Moderna is looking into modifying its current vaccine to try to provide multiple avenues of protection against those different variants. And those that vaccine is currently being planned for additional testing that has to happen before it can be released into use and production. But that won't take as long as it did to create the original vaccine. So there'll be some shortened testing to make sure that a revised vaccine that works for multiple strains is safe.
All right. We do have an email question. I'd like to get to that, and I believe Dr. Burwell might be able to address this one best. So Nancy writes, I had Rituxan treatment. The last one was on December 21st of last year, 2020. Can I still get the vaccine? If so, when? This is one of many questions I know that the doctors are facing on the front lines and those who are registering people for the vaccine. So Dr. Burwell, maybe go through some of, I know the staging we're at and what people can present and still get vaccinated with.
Right. I think that's a great question because they're looking at whether or not if you're on maybe a drug or medication that alters your immune response, when is the best time to be vaccinated? The question specifically, if you are taking a medication that substantially alters your immune response, you should have a discussion with your doctor. And the discussion may not necessarily revolve around whether or not you should be vaccinated. It may be about the timing of the vaccine. So if somebody's on a dose of steroid medications or things that may alter your response, there may be a more optimal time to be vaccinated. So I do highly recommend that if you are on immunosuppressant medications or medications that alter your immune response, that you have your discussion with your doctor as far as not only is the vaccine right for me, but also what is the best time in my course of treatment to receive that vaccine.
All good points. Thank you. If you're just joining us, I'm Carolyn Donaldson. This is Conversations Live, COVID-19 special on WPSU. Joining us tonight, our experts, Dr. David Burwell and Professor Beth McGraw. Our toll-free number, we want to hear from you, 1-800-543-8242. We're ready to take your calls. You can also send us questions by email at connect@wpsu.org. Let's go to look at the eligibility of folks right now. And there's been some concerns and some questions about who's in, who's out, what order, what am I 1A, 1B, 1C? And here in Pennsylvania, maybe first walk us through the steps of how those criteria were determined and where we're at here in Pennsylvania and right here where folks are watching and listening to us tonight. Beth, do you want to start with where the lines are at this point?
So right now we're in phase 1A, and so that was for older populations initially, and then now moving into populations younger, under 65, who may have pre-existing conditions. And I think the doctor can probably speak to that a bit better about that list. But phase 1B starts moving into some additional categories relating to increased contact for people in the public. But right now we're still just trying to take care of people who might have health conditions. And doctors and nurses as well, frontline workers are included in that phase 1A.
Dr. Burwell?
Yeah, so that list is on our PA Department of Health website as far as what level we're in at this time. It has changed. It did change a few weeks ago. More people were creating greater eligibility. It started off at folks that were in healthcare, folks that are over the age of 75, and folks that were in skilled nursing facilities. And then it's gone down through people that are 16 and above that have certain comorbidities and health conditions. So I highly recommend that you review that list and see if you're eligible at this time, and if you are, that to seek vaccination. But yeah, I think some of those do alter and change over time. Previously, they were more role-based, and there's still role bases in there as far as whether you are a teacher or a bank teller. But there are additional health care demographic changes that got put into play as far as age and also comorbidities like diabetes and COPD or chronic lung disease.
All right, and what we're looking at right now is actually that pa.gov website. So let's talk a little bit about that, because I guess perhaps Beth has the best description. The folks who have been able to get the vaccine from all indications are those who are aggressively searching. And there you see one of the more optimal ways that has been traditionally how you can at least find out where the vaccines are being given, and being computer savvy enough to get in there, click on the dot, get to the appointment, get to register and things like that. Dr. Burwell, you are sitting 2 days after you've introduced a brand new website and a new vehicle to be able to get folks within the UPM system and beyond in your registration process. So maybe start us off with, how easy is it? How difficult has it been? And maybe even some tips from both of you on how folks can. I've been hearing it all over that it's just impossible for folks to get on the list, so to speak.
Yeah. At UPMC, we've been very excited. We have given over 160,000 shots of the COVID vaccine in the Commonwealth, and really we've been giving those out to a lot of different groups. Whereas it's over 41,000 to folks that are not affiliated with UPMC. And we are really excited about our ability to pivot and go more community-based. So we have recently launched our vaccine.upmc.com website, and that gives the ability to register and then receive callback or text or email for scheduling to receive your appointment to get your shot. So we're really excited about this opportunity to pivot to the community. And we recently started, at UPMC Altoona, we opened up today. We gave 60 doses and we have 150 scheduled for tomorrow. But we're really excited to do a whole lot more. And I do believe that we are uniquely positioned in order to do significant vaccinations on a daily basis. So very excited about the potential moving forward, and looking forward to working with the state on the supply.
And Beth, can you add to that discussion about what you're seeing, in your role and looking at getting as many people vaccinated again as quickly as possible? And we'll talk about the herd immunity and some of those things. But how important is it to ramp up, especially now, perhaps with the advent of the Johnson & Johnson vaccine soon becoming available in this state? What are your thoughts there?
The first thing I would say is that, if you have older family members that you're concerned about who aren't maybe very tech savvy, I would, and friends and family, I would reach out to help them get onto some of these lists. It's a nice way to try and make sure that the people who most need the vaccine are finding their way to these lists. And yeah, I think the exciting thing about having yet another vaccine is just hopefully greater numbers. It will take a little bit of time for Johnson & Johnson to ramp up production to the scale that we're seeing with Pfizer and Moderna. But hopefully as that happens over the next couple of months, we can have far more. And again, the goal here is just to get as many people vaccinated as fast as possible.
Okay. And is anyone willing to go on the record right now on our show and talk about when will the average people be able to get vaccinated? Can we look ahead? Do we see now with how the supply's doing, your ramping up of your program, Dr. Burwell, any indication when things might return to, quote, normal, I guess, as normal as perhaps our lives may be going forward?
I think that's a two-pronged question, what you mentioned. You said vaccine distribution and increase in there and then return to normal. That I will let my colleague take that question, the latter. But we're very excited about the opportunities of additional vaccines. If you see what the federal government has procured from Moderna and Pfizer, and then now it appears to be from J&G, that we should have substantial vaccines in the works and available here by the summer. So that, I think that's pretty exciting. Procuring the vaccine are one thing, but getting people vaccinated is something else. And I think Beth McGraw also brought up a very good point. We can't just have this websites and to be tech savvy. We have to make sure that we are low tech as well. And we realize that. So we have created a phone number, 844-UPMC VAC, in order for folks that can dial us up and we can get you on the list and take care of you. And I think that's a really good point, because we do need to make sure that we take care of all cross sections of our population. But yeah, I do believe that we'll have a fair amount of vaccine in the works. I think I'm not going to predict an exact date for you, Carolyn. I'm sorry, but I'd love to hear the professor talk about what she felt would be the slowing down of the pandemic, or what that looks like, or timing.
Yeah. So how quickly we get back to normal depends on how rapidly we're able to vaccinate people, and whether we can sort of get in front of new variants coming into the population. And so ideally over the summer, we should be able to see declines in transmission to a point where we feel like we're making headway. Whether we'll be able to take our masks off, before fall, I think that's a different question. I think there are a number of issues going forward. If we have large segments of the population that's not vaccinating, then we will continue to see the virus circulating. So it's important as much as possible to convince our friends and family of the safety and the efficacy of these vaccines so that we can all be stronger and safer together. And also, we're still not sure yet whether the vaccines prevent transmission. So even for vaccinated people, they're going to need to take care around others to make sure that they aren't spreading the virus. So hopefully we'll have more data on that in the coming months. And so it's really impossible to predict when exactly things will be back to normal. But I think we understand all the factors that need to come into play for that to happen.
And things are moving in the right direction for all of that to happen, so that's reassuring. Yeah. We do have a caller, David from Hollidaysburg. Thanks for holding on. Your question tonight, sir?
Well, hello. Thanks for taking my call. Today in the Altoona Mirror, there was a phone number. UPMC announced that they were going to give vaccinations at Station Mall. I tried calling that number almost 20 times, and the note came up that the call had failed. I tried later this afternoon, and they said the number had been disconnected. So, and then I also tried the website, but I could never connect. What is the doctor's suggestion for those of us who do want to make appointments but are not able to make contact with the phone or the website? Thanks for taking my call.
Thank you, David. Dr. Burwell?
No, I appreciate that. And I appreciate that, David. And I appreciate the challenges that you're having as well with even phone and technology. So I would like you to call the number I just referenced, 844 UPMC VAC, in order to do that. The number in the paper today was not that same number. We have shifted. But I do believe, even with that sort of thing, I think that we can do it, and that's why I'm coming on the show tonight, to really help espouse and show those other options available to you. So I do think that the phone number would be a good thing. I do know that we did have some technical issues specifically today. So I would recommend that you please retry that, even the website, as well as tomorrow. We did have some specific technical issues today, and we're sorry about that. We really want to get you in and involved and get you vaccinated.
Right. Can I say also currently there's a bill being examined in the House, in the Pennsylvania State House, trying to look at ways to get PA Health working with the National Guard to help set up vaccination stations, particularly in rural areas. So this is being used very effectively in other states. The National Guard's really good at logistics and rolling out large-scale initiatives. And it's also just an extra set of hands on top of our current healthcare workers and people running pharmacies, et cetera. So I think there are exciting opportunities going forward to get that extra manpower and organizational skill behind deployment, particularly as the supply of vaccine increases. And the problem will not be about access, it will be about how do we deploy it.
Good points. Thank you very much. And I do want to ask Dr. Burwell just an additional question when we look at still that doctor-patient relationship through this process. That's still critical, right? If somebody, as you explained earlier, has some pre-existing conditions or is on some medication, to contact your local doctor, wherever that may be, is still an important part of this process, Dr. Burwell?
Yeah, I agree. You have to go to your trusted source. Your primary care physician is definitely key. Your medical home is definitely key. If you have a question that's very specific to you, maybe you feel that you have an allergy to something, or you do have a certain allergy, and you want to make sure, is this safe for me to take, or is this the right thing for me to do, and what can I experience? I do recommend having those discussions with your primary care physician and your trusted source. I think that will really make sure that people feel nice and comfortable and informed when they do get vaccinated. So highly recommended, Carolyn.
All right, thank you. Dwayne from West Decatur is calling in right now with his question. Dwayne, thanks for holding your question.
I'm trying to decipher which is the best of the vaccines. Why is some of them 2-dose and the other one is 1 dose?
We did explain a little bit of that in the earlier discussion, and we showed a little bit of the graphics, but Dr. Burwell, do you have a kind of layman's answer for that so that we can kind of understand why, and will we have a choice, I guess, in Pennsylvania as to which vaccine may be given out? How is that working?
Sure. Right now, I don't have specific clinical scenarios for you or recommendation between one vaccine over another. Especially if you look at the Pfizer versus the Moderna, the mRNA vaccines, they are scientifically very similar. The only significant differences are storage mechanisms and how long it takes, or the intervals between your first and your second shot. So, I mean, really, for somebody receiving the shot, very little. So I do not see significant differences between the two. There are some differences that we're noticing with the J&J vaccine as far as immediate efficacy, but we are still highly recommending it because the overall efficacy against serious disease seems to be very significant. Also, there's subsections of the population that one shot is best for, and that we can get to them. So right now, I can't tell you that if you have X, Y, and Z that you should get the Pfizer versus Moderna. We're not really breaking it down to that point. We're noticing that what's coming out is they're all very safe and they're all very effective. And I don't know if Dr. McGraw wants to talk about any of the efficacy as well, but I think we're pretty blessed with what we're seeing.
Okay.
Yeah, I think some of the reasons around why you might see one only needing one shot versus the other needing two, they're made in different ways. So the Johnson & Johnson has, a different, it's been built in a different way. It's going to trigger strength of immunity in different ways. And so it's really just also about how they were tested and what we have our data for. And so I wouldn't worry too much about whether it's one shot or two shots. And does that mean something about its efficacy? I think they're all very efficacious vaccines. And at this point, when the vaccines are still rare, my advice would be to get the one you can as soon as possible.
Okay, that makes sense. Beth, continuing on, do we know yet if you can pass on or carry COVID-19 even after you've been vaccinated? What is the latest science telling us and research on that issue? And Beth, maybe start the discussion, and Dr. Burwell, you add to it?
Yeah, so, when all the phase 1, 2, and 3 trials were run, what we were testing for was the presence of disease. So we can say with strong surety that the vaccines are preventing people from having symptomatic disease. What we didn't test for was whether there was virus in the body of people who were infected or whether they could potentially transmit it. Those are harder studies to run, because it's very hard to sample and make sure you're testing for presence, absence of virus. It can be rare in the body. And so when these studies were run, they were done really quickly to very quickly decide whether these vaccines would be safe or not and efficacious. It's going to take longer to go back and do the additional groundwork to figure out whether people who have had each of these different vaccines are still capable of being infected by the virus. And even if they do have virus in their body, it doesn't mean that they'll be able to transmit it. I think we still have more work to do scientifically to nail down that last bit of the question.
Mm-hmm. And Dr. Burwell, any additional thoughts there?
I think that's going to be very important, but I think you also see that that's why the recommendation is to continue to mask and hand wash and physically distance after you receive the vaccine, because we really still need to know that additional information. Having said that, though, we are noticing some changes, especially even the CDC is noticing some changes as far as after full vaccination. If you have an exposure, their recommendations for quarantine change. So they have recognized that it appears to provide you with some protection, with decent protection, but also there may be some additional things there as well. And I think that's important, especially for those in the workforce as well. Quarantine can be very difficult and can also really cost people a lot of time and money and livelihood. So I do believe that vaccinating and making sure after full vaccination, even if you are exposed, the CDC recommendation that you don't have to quarantine is pretty substantial. Now, they're not saying you don't have to mask. They're saying you do have to continue those other mitigation strategies. But I think that's a step in the right direction. And we'll see out of the additional studies, like Dr. McGraw mentioned, what comes of it. We're seeing some early positive information out of Israel regarding it, but it's still early. So we look forward to having that additional information.
All right. Let's take a sidestep a little bit, and I want to ask for those who may have battled COVID-19 or are now having loved ones or others, what is the current treatment process for someone? I understand, Dr. Burwell, there are some medications, and of course we see the case numbers coming down significantly in Pennsylvania, of course, and understandably the death toll numbers also coming down. But what are we seeing for those on the front lines in treating COVID? Can you address that?
Yeah, some of the treatment has evolved and changed substantially. What we found over time is what works and what doesn't work. We found a lot of things that do not work, unfortunately, and I think that's come through the media substantially. We know that the number one thing is obviously preventing infection by masking, hand washing, and physically distancing. But we've also found out that certain other things are helping reduce hospitalization and severe disease. And one of those things is the monoclonal antibody infusion, that if somebody within 9 days of their illness and that have certain comorbidities can receive this infusion. We're noticing that the supply of those monoclonal antibody treatments are improving substantially. So we're very excited that UPMC has delivered a substantial amount of monoclonal antibody infusion to the residents of Pennsylvania that are afflicted with COVID. And we would like to continue more as the pandemic continues and infections continue to offer that as one of the many caveats. Vaccine, mitigations as far as prevention, mitigation strategies are all still key, but we're going to notice pockets of infection for quite some time due to, as mentioned before, that there may be folks that were reticent to vaccinate appropriately. Mm-hmm. So we look forward to giving those opportunities and options, but we are noticing that it does help reduce the severity of illness and also hospitalization.
All right, thank you. We've got more calls on the queue here, and let's get right to Catherine from Gallitzin. Good evening, Catherine. Your question?
Hello?
Hello, yes, Catherine, you're on. Your question, please, to our experts.
Yes. I got the first vaccine shot back in January the 30th, and then my arm got all black and blue, and then about a week later, I got a rash all over the top of my arm where I got the shot. So now I'm supposed to go and get the second shot on Saturday, and I don't know if I should get this shot or not. I don't know if that was allergic reaction or what it was.
All right. Thank you for your question. Who would like to address that? Dr. Burwell?
Yeah, I think with if she has substantial concern as far as what she had as far as a rash or things like that, I think that would be a good discussion for her to have with her doctor as far as what to proceed with. We would really like to see people complete the vaccination cycle as well. I think that offers them the highest efficacy for protection. But for Catherine's specific issue and question, I think she would feel more comfortable seeing her doctor and her trusted source to make sure that her question is answered. Mm-hmm. So I highly recommend that. I don't, obviously swelling of your arm and a rash is something that we see with an immune response, but I think we do. I think that for her to be really feel comfortable, I think she may want to ask her doctor about that. Dr. McGraw, do you have anything to add to that recommendation?
I think that's a good answer. Thanks.
Okay. We have Linda from Bradford. Linda, good evening. Thanks so much for joining us. Your question tonight?
I don't think I've heard this addressed anywhere, and I'm curious about how long does this series of vaccines that we're getting now are good for, if they have any idea yet when we need to take next series or boosters or whatever.
Mm-hmm. Good question. Thank you, Linda. And I know Beth had some thoughts on that right now as I pose that pre-show tonight.
I'll start us out. I mean, I think that we know that it's
She's talking
likely.
because I can't hear her on the phone.
Okay, sorry. It's likely that we might need additional boosters or altered vaccines in the future if the virus continues to evolve and change, as we do for the flu vaccine. We know, though, that immunity is lasting at least 8 months for people who have had the infection. And then soon we'll see whether, we assume that immunity will have similar lasting effects from the vaccines themselves. I think we're less concerned about the length of immunity at this point, but we might have to confront issues about a changing virus and whether we can come up with new and improved vaccines in the future to keep up with that evolutionary change in the virus. But we're already seeing that happen with Moderna. They're planning for that right now. And it's something that, we have experience with in the past with respect to the flu vaccine.
Dr. Burwell?
I have nothing additional to add to that. I think we would like to see the vaccines last for a substantial amount of time in order to really reduce. But I do think that there will most likely be boosters or the like, depending on the length of the pandemic.
All right. Throughout the process tonight, you've talked about, checking in with your local doctor and accessing your local health care. So I do have to ask this question. Folks have posed this to me. Does access to health care with health insurance affect the access to the vaccine? I think that's an important point that we need to clarify for folks. What is needed when you do get to that vaccination site, and do you have to have proof of some sort of insurance? I know in your case, UPMC, you're welcoming folks from outside of your network, but how exactly is that working that you see?
Yeah, so in UPMC, we are not asking for health insurance information. We are not charging for the vaccine or the administration. The vaccine itself it has been paid for by the federal government, but we're not charging for administration, even though there are certain places they're within their rights to charge for the administration. So we are not. So we are not looking at whether or not somebody has certain health insurances or not at our vaccination site.
And Beth, does anyone get to go to the front of the line because they do have a plan over another plan that you see, at least here in central Pennsylvania or Pennsylvania throughout?
No, I think there have been some reports in the media of people sort of trying to skip up the line of hierarchy based on, various criteria. I think for the vast majority of people, individuals are trying to respect the queue and respect the characteristics that are determining who's currently being vaccinated. And so I think, the most important thing is to try and get as many people vaccinated as possible.
Great. Okay, thank you. We do have an email coming in. Bill from Johnstown writes, my wife has both lupus and RA. She's severe reaction to the flu shot years ago, advised by her internal medicine doctor to not have it any longer. How likely is it that she would have an allergic reaction or other issues with these vaccines, the COVID-19 vaccine?
I think Bill's question is a good one. So we really have limited are the folks that cannot get the vaccination. So, but there are certain people, if they are obviously allergic to these vaccines or have had significant severe allergic reactions to a previous vaccine, those are ones that really need to have caution. And what I mean by severe allergic reaction is if you required an injection of a medication to stop the reaction from a vaccine. So, but with that, I think his question is spot on. That is an individual that needs to discuss with their doctor. Maybe there was something specific in that influenza vaccine. Maybe it had egg, or something that was that's not in the COVID vaccine. But I think that would be a perfect situation to have a discussion with your provider as whether or not you should be vaccinated.
And Beth, are you seeing some CDC recommendations on those when we talk about who should not be vaccinated at this point?
Yeah, I think, the CDC is echoing what Dr. Burwell is saying there. If you're having extreme allergic reactions, if you're commonly someone who has these type of responses, if you're someone who carries an EpiPen, have those conversations with your doctor.
Okay. A couple more questions about the effectiveness of the vaccine and post-vaccination for those who are able to get it at this point. Is it worth wearing 2 masks rather than 1? Do the masks protect the person wearing them or just the people around them? We've heard differing theories on this, so let's dispel that and ask our experts tonight what their theory is, especially with now not 1 but 2 masks being recommended in some cases.
I think, very recently the CDC put out some guidelines suggesting that if you wore a surgical mask with a cloth mask over it, that you would prevent inhalation up to 97% of vaccine particles. And so that's really useful not only for preventing infection from you to others, but also protecting the wearer. And so I think that's an exciting bit of data for the public to know about. So if you're in a circumstance where you're uncomfortable or you're in an area where maybe you can't completely physical distance from people, and if you're comfortable wearing 2 masks, I'm sure Dr. Burwell can speak to some issues around that, whether that might be difficult for some people. But certainly if you want to make sure that you are not exposing yourself, if you double mask, you can be assured of greater safety.
Yeah, I totally agree. As far as the masking goes, obviously they're discussing increased filtration, so that's pretty basic knowledge, and I think that was the understanding. I specifically just would like people to wear a mask at least. Mm-hmm. So I'm really not going to the extent of the double mask, but at least a decent mask would be extremely helpful. And yes, I do believe it protects both parties. I know there was some concerns up front that it may just be for other individuals around us, but mm-hmm. I do believe that filtration also confers protection for us as well. And that's what we're seeing in the clinical environments where we are taking care of COVID-19 patients on a regular basis. The protected personal equipment is very effective in protecting healthcare workers. So yeah, let's not go into the whole double mask idea. Let's stick to basics and wear a good mask up front.
All right. Email comes in from Tony, and this is another population that we haven't addressed. We want to get to that. Our phase 1 studies being done on children so that when vaccines are available for that demographic, they'll be eligible to receive them. Where do things stand for that population base? Beth, are you able to start?
I'll start us off, and then Doctor can finish it up. So if you have a 16-year-old, if you're thinking about your children, the nice thing about Pfizer is that children from 16 and up can use that one. So that's good to know. The other vaccines are currently being explored in that vaccine as well in younger populations of children. Those studies are underway or they'll be rolling out over the summer. And it's hoped that by late fall, potentially, we would have the ability to deploy these vaccines in children. So similar sort of safety testing has to be carried out, as was for the original vaccines, that phase 1, 2, and 3 safety testing, just because children are different, their immune systems are different. So we want to make sure that their vaccines are both safe and efficacious in this sort of different group of people with different physiology.
All right. Thank you. Hey, we are almost out of time, and I do want to get to your final thoughts. And I kind of want to pose this in a little bit of a question that I think kind of generalizes it. But after our discussion tonight, our conversation, our calls, what would you each say to someone after hearing this who may still be hesitant to getting vaccinated? What is your final ideas and good science behind their purpose in getting vaccinated as as quickly as possible and as doable, as they fit into their vaccination process. Dr. Burwell, we'll start with you.
Yeah, I think that it's really important to find out, why do you need the vaccine? Why do you want to vaccinate? Is it for your own personal health, or is it the health of others around you? I think that's really key for determining why you want to be vaccinated. I think that you'll be much happier whenever you answer that question for yourself. And also, it may not just be for yourself and for those immediately around you, it may also be for society as well. So we will put a push out there to vaccinate, to make sure that it's part of the end process of the pandemic. And we really think that's extremely important. This is a very safe vaccine, and it's very efficacious. So we are very, like I said before, blessed to even have this option, especially in this time period. So I do recommend folks take advantage of the opportunity when it's your turn to go ahead and get vaccinated.
And Beth, as the Center for Infectious Disease Dynamics at Penn State, you've researched this for many, many years, of course, and your colleagues. What is your number one sales pitch to the folks out there watching and listening tonight?
I think I would say, vaccines are the single best invention in modern medicine. And they've been protecting us for decades from a lot of diseases that we've gotten used to no longer being a problem for us and our children. And this is just another version of them. We've got a long history of safety, and these vaccines are incredibly safe and incredibly efficacious. And so I think it's a really exciting opportunity to let people get their lives back to normal and see, declining reductions in severe illness and death across this country.
On the front lines of the COVID vaccine, we appreciate our experts' time tonight. Our thanks to Dr. David Burwell with UPMC and Professor Beth McGraw with the Center for Infectious Disease Dynamics. We're going to leave you tonight with some additional resources. Again, check out your local resources. Check with your local doctor. If you're in the UPMC area there, of course, Dr. Burwell has his new website and phone number to call. We thank you so much for joining us tonight. Be well and safe.
Thank you.